An update now on the Affordable Care Act in the most populous state, California. Covered California says that since the October 1st kickoff, nearly 80,000 Californians have enrolled in private health care plans through the state's online exchange. Data shows that more than a third of the enrollees in the state-run marketplace were aged 55 to 64, showing that so far more older adults have signed up for the new plans than younger ones in the aged 18 to 34 group.
Well, Susie, 7 weeks after the launch of the Affordable Care Act's healthcare.gov online marketplace, people are still having a hard time gaining access to the website. But once they log on and see all those insurance plan choices, they still have to choose which one suits them best. Bertha Coombs joins us now with more on the challenges facing some young people who are buying insurance for the first time and finding it very confusing.
Yeah, I mean, it's daunting for a lot of us who are used to buying insurance every year during open enrollment season. Choosing the right plan can be tricky, but for the millions of people buying insurance for the first time on these new health exchanges, there's a real learning curve here. And in some cases, because there are too many options and not enough tools to figure out how to pick a cost-effective plan.
30-year-old real estate agent Michael Chadwick is overdue for an MRI screening after having a benign tumor removed from his leg back in college.
The past couple of years, I've been in that great bracket of making too much money to qualify for aid, but not making enough with all my other bills to afford health insurance.
28-year-old graphic artist Katie Irwin has put off dental surgery and insurance for the same reason.
I just haven't been able to save up the money.
The New York City freelancers are exploring the new Affordable Care Act plans on their state's exchange. It's the first time they're buying insurance, and they're finding sorting through the differences between deductibles, out-of-pocket costs, and copays overwhelming.
So here's one of the dentals.
Katie found more than 70 options to choose among. Those with lower deductibles and dental coverage were pricey.
This is $374, and the tax subsidy that I get is $64.
She's leaning toward a catastrophic plan for her age group with a dental supplement for about $210 a month.
With catastrophic, I'm not spending a catastrophic amount of money.
Michael's also leaning for a lower premium option, but worries about high out-of-pocket costs.
So free physical, but if I get the flu and I want to go see a doctor, I still got to pay 50%.
Specialists at firms like online brokerage Gravy help people sort through those variables. Mike Fortner found Katie's catastrophic option is a good one, despite up to $6,300 in out-of-pocket costs.
When we dug deeper into this one, as long as she stays in the network, the first 3 visits to the doctor every year are free.
For Mike, who needs access to MRI screenings, Fortner thinks a mid-range plan will offer more.
He can have a little bit higher payment each month to the insurance company, but when he goes to use the insurance, the payments will be a little bit more affordable.
Columbia professor Eric Johnson says most state exchanges don't have the right comparison tools to sort out the trade-offs on plan costs, leaving most people to guess.
They're basically almost as accurate as if they were throwing darts.
That could be a costly mistake for people like Mike and Katie, and for the government and taxpayers who'll foot the bill for billions in planned subsidies.
We've calculated that if you actually do websites right and include the kinds of things that help people make better choices, every year you could save the government, that is us, $9.5 billion.
That's a very big chunk of change. Johnson says that California actually has one of the best calculators of all the new exchanges. Meantime, some news this afternoon from the Golden State. The board of Covered California has decided against President Obama's insurance fix and will not let insurers extend canceled plans. They're joining Massachusetts, New York, and also Washington State. These are areas where the enrollment on the exchanges is going well, so they don't want to disrupt that.
Bertha Coombs, thank you very much. Appreciate it.